Kathy. I'm a registered psychologist. I've been working in the psychology field for the last couple of years. More broadly, I've got about a decade's worth of experience working with parents and carers while I've been doing my training to become a psychologist. What drew me to perinatal psychology was the opportunity to, provide the ultimate early intervention. So we're really thinking about the huge developmental phase that you enter when you become a parent, the huge changes in all your relationships, how tricky that can be to navigate, and just knowing that those changes that you can make at that early stage can have such a difference to your parenting journey. To be a part of that, to my own values as a parent and myself, and also wanting to support that, is to really sort of tap into that. We all would like to be a great parent, the best parent that we can be, and so sometimes we just can do with a little bit of help with that. And so I just think that's a really exciting space to be in. So some of the common challenges that we see in this perinatal period are changes in mood. So we can see much lower moods. That can be anxiety or depression, stress or distress, struggling to cope, feeling teary, feeling a little bit hopeless, feeling like things are just getting on top of you, hard to feel joy in this parenting period, medical challenges and our adjustment to those medical challenges, especially pregnancy has been difficult, challenges in birth, so there can be birth trauma, and our expectations of what the birth process was going to be like, then adjusting to baby getting here. What's that like? Learning to feed in whatever way works for you, and that in itself can be really distressing. I should feel happy, I must do this, those sorts of expectations that we put on ourselves, and we can end up feeling pretty lousy. If I had any advice for parents proactively caring for their mental health in this time, is to start to really build that awareness of where my mood is sitting, how I feel like I'm traveling, and really kind of don't sort of expect that you can just have to struggle on without sort of getting help. It's okay to ask for help. The thing about perinatal is there can be some stigma around, if I say I'm not coping, then does that mean I'm not a good parent? And we do see that a lot, when in actual fact reaching out for help is the most kind of proactive thing that you can do. It shows incredible strength, it shows incredible courage, as opposed to being a weakness. If there's times when you are really overwhelmed and it feels difficult to even leave the house or even to know how to reach out for support, the great thing is that there are so many more telehealth options now. So seeing your GP by telehealth, just making that first line of connection to your GP, and then getting referred to a psychologist who can see you via telehealth as well. We know that period of time is tricky. We've got little people around, we've got new babies. Trying to kind of do that, navigating getting out of the house can be really hard, especially if we already feel overwhelmed. And one of the reasons why I love telehealth for myself as a practitioner is that it just gives mums and dads flexibility. In terms of why you would want to access this support, proactive, like we would with our health in general, we can see it in the same light. So that sense of, okay, why don't I proactively think about what it might be to become a new parent and start to do that preparation before baby gets here? What's the changes in my relationship going to be like? How will we navigate that as a couple? How do we go from being a duo to a trio? How are we going to decide, who does what? Where's the stresses going to come up in our relationships? Having somebody to talk through those challenges, to help normalise some of that experience, to just, maybe learn some different ways to think about things. It doesn't mean that, there's a big problem. It just means that you just need a little bit of a sounding board, somebody to walk alongside you while you're learning in this big developmental phase of your life.